I mean, that would be great if we did see people.
We're trying to create awareness for stroke and also to raise funds for our project called Rehab 77. So we could get equipment for rehabilitation in Lowen.
And I know I would have bought some plants for you.
Oh, so lovely.
So basically, May purple is it's a stroke prevention day. It's a whole month actually. We are trying to prevent a stroke. So as stroke is one of the leading cause of death and disability, one of the fourth leading cause of death and disability. If you look at the statistics here in the UK, there are 1.2 million stroke survivors, and there are 100,000 strokes happens every year, and one stroke every 5 minutes. So it's a quite disastrous condition. We want to prevent it not to further happen. So that's why we're holding this stroke prevention day, so that we can educate the people about what are the risk factors.
So it's all about prevention is better than cure, and actually if we can prevent our patients developing the symptoms in the first place, that's obviously better than trying to cure it. But you can only reduce your risk if you know about it. So it's highlighting the modifiable risk factors for patients.
Everybody should take the opportunity to donate to the Stroke Association and continue the good work that they do to make things very much better for victims of stroke and improving the quality of their lives after the incidence of stroke. Please donate all that you can afford. That will be very much appreciated by everybody who has suffered from this cruel affliction.
So I work in the A&E department here as one of the A&E doctors. I've seen the effects of stroke and the lifelong consequence. I've done a stroke drug previously. My advice is the stroke service is absolutely incredible here. They're here and the treatment is just beyond question. But what I would advise everybody to do is to prevent it happening in the first place. So look at your diet, look at your exercise, and this goes with all the preventative illnesses like COPD, type 2 diabetes, all of which are risk factors for stroke. Don't smoke, eat good food, exercise. There's nothing complicated about good health. Everyone can do it.
So much. Thank you so much. So we are having the handing over
Thank you.
Thank you.
I would just like to thank everybody for this and their hard work, and keep up the good work.
Thank you very much, sir.
So know your numbers, know what your blood pressure is, and make sure to have those well person checked.
Thank you.